So, Kinrix Vial is a combination of vaccines that help protect against diphtheria, tetanus, pertussis, and polio. These vaccines are essential for preventing these serious and potentially life-threatening infections. They work by stimulating the body to produce its own antibodies for protection. It's important to note that while vaccines are highly effective, they may not provide full protection for everyone. It is recommended to follow the prescribed dosage and timing for the best results. Always consult with a healthcare professional for the most accurate information. Before receiving the Kinrix Vial vaccine, make sure to read all the vaccine information provided by your healthcare professional. If you have any questions, don't hesitate to ask them. The vaccine is administered into a muscle by a healthcare professional, typically in the thigh or upper arm. To ensure the best protection, vaccines are usually given in a series of doses. It's important to closely follow the vaccination schedule provided by your healthcare professional and attend all scheduled medical appointments. You may find it helpful to mark a calendar as a reminder. There are various combinations of vaccines available, so it's important to discuss the risks and benefits of vaccination with your healthcare professional. Some common side effects of Kinrix Vial include pain, swelling, redness at the injection site, mild fever, drowsiness, tiredness, headache, nausea, and loss of appetite. If any of these effects persist or worsen, it's important to consult with your healthcare professional. They may recommend the temporary use of acetaminophen to treat the pain and fever caused by the vaccine. Rarely, some people may experience symptoms such as fainting, dizziness, vision changes, or ringing in the ears after receiving the vaccine. If your child experiences any of these symptoms, it's important to notify your healthcare professional immediately. Sitting or lying down can help alleviate these symptoms, as they typically don't last long. It's important to remember that this medication has been prescribed because your healthcare professional has determined that the benefits outweigh the potential risks. While many people using this medication do not experience serious side effects, it's crucial to inform your healthcare professional if you experience any high fever, numbness/tingling, muscle weakness, difficulty breathing, seizures, or signs of a serious allergic reaction such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your healthcare professional if you notice any other effects not listed. If you have any concerns about the side effects of Kinrix Vial, it's best to consult with your healthcare professional for medical advice. Before receiving the Kinrix Vial vaccine, it's important to inform your healthcare provider if you have any allergies to vaccines, neomycin, polymyxin B, or latex. This is important because the vaccine may contain inactive ingredients that can cause allergic reactions. You should also discuss your medical history with your healthcare provider, especially if you have a current fever/illness, immune system disorders, brain/nervous system disorders, or a history of Guillain-Barré syndrome. If you are pregnant, the vaccine should only be used if clearly needed, so it's important to discuss the risks and benefits with your healthcare provider. Additionally, it's currently unknown if the vaccine passes into breast milk, so consult your healthcare provider before breastfeeding. It's important to be aware of potential drug interactions with Kinrix Vial, as they can affect how the vaccine works and increase the risk of serious side effects. Make sure to keep a list of all the medications and herbal products you are using, and share it with your healthcare professional. Do not make any changes to your medication dosage without consulting your doctor. Some products that may interact with Kinrix Vial include drugs that weaken the immune system, such as cyclosporin, tacrolimus, cancer chemotherapy, and corticosteroids like prednisone. Be sure to discuss any concerns about potential interactions with your healthcare professional. Kinrix is a vaccine used to help prevent diphtheria, tetanus, pertussis, and polio in children. This vaccine works by exposing your child to a small dose of the bacteria or a protein from the bacteria, which causes the body to develop immunity to the disease. It's important to keep track of your vaccine records for yourself and your children. This will help prevent unnecessary revaccinations in the future. By providing these records to your healthcare professionals, they can ensure that your children are up to date on their vaccinations as they grow older. This will help to protect them from preventable diseases. Make sure to keep track of when you or your child received the last Kinrix Vial vaccination, and make sure to follow the recommended vaccination schedule. This will help ensure that you or your child receives the full benefit of the vaccine. Remember to store Kinrix Vial in the refrigerator, but do not freeze it. Make sure to keep all medications out of reach of children and pets. When it comes to disposing of this product, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, consult your pharmacist or local waste disposal company to properly discard it when it is expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.